Interpretation of complete blood count. In complete blood count, we see platelets. In platelets, generally we see it's a high platelet number or low platelet number. That is either thrombocytopenia or this is thrombocytosis. But there are a few other parameters which are seen in a CBC report regarding platelets. So we see what are these. These are mean platelet volume and platelet distribution width. So they are counterparts of RBCs in the platelets, that is MCV. Instead we have MPV, mean platelet volume, and red cell distribution width. Similarly we have a platelet distribution width. So the MPV means the volume of the size of the platelets, while PDW means platelet distribution width, the variation in the size of the platelets. Now, what are the factors which affect these, and what information we get from these MPV and PDW? You see, this is increased in inflammation and infections like inflammatory bowel disease, rheumatoid arthritis, sepsis. You may find that the MPV and the PWD, they are increased. Similarly, in atherosclerotic cardiovascular disease, if the mean platelet volume or the platelet distribution width is high, you should suspect that the patient may have increased risk of coronary artery disease and strokes. Similarly, various malignancies, they can be a reason when you have a high MPV and PDW. For example, hematological malignancies like leukemias and lymphomas, and then certain other malignancies like carcinoma of the lung, breast, larynx, ovary, endometrium, rectum, kidney, stomach, pancreas, and brain. They all may be associated with high MPV and PDW. And then there are miscellaneous conditions like diabetes mellitus, COPD, and thrombocytopenia, thrombocytosis, birth control pills. They all can be affiliated with high mean platelet volume and the high platelet distribution width. So these may give us an information that if a high MPV or PDW is present despite having a normal number of platelet count, you should think of these possibilities and you should explore these.